Waka, greetings. Hello, everyone. My name is Patricia Cochran. That's my English name. My Nupek name is Sikwana. I am a Nupek Eskimo born and raised in Nome, Alaska. I'm also the director of the Alaska Native Science Commission and the chair of the Inuit Circumpolar Council. The Alaska Native Science Commission is an organization that works with our communities in Alaska and actually in Inuit communities, Native communities throughout the Arctic, to help promote relationship building between researchers, scientists, and communities, to really help to strengthen that relationship and to make partnerships, active partnerships between the researchers and communities. I guess I'm not exactly sure where I fit into that picture, but I really am, I think, more of an administrator. My job is to help facilitate that dialogue, and I think that that's actually where my real strengths are. I was trained professionally by my community, by my own people, to be a facilitator. I spent more than a dozen years apprenticing with my aunties and with my elders to conduct traditional talking circles and to learn the Native ways of being able to hold discussions, of setting priorities, of just having conversation and helping to create dialogue and to resolve problems and issues within communities. So I think that that's probably really my role more than anything else. I'm not a scientist, but I really work a lot with scientists and then work with communities to try to build those bridges.
My name is Jim Berner. I'm a physician, a pediatrician with the Alaska Native Tribal Health Consortium, and my job is to look at and try and improve the health of communities for Alaska Natives. And that is essentially a public health undertaking. However, the public's made up of individuals, so in fact, it's individual actions that eventually determine public health. And today we're going to talk a little bit about human biomonitoring. Human biomonitoring literally means biologically monitoring humans.
Hi, my name's Carl Hild. I'm with the Institute for Circumpolar Health Studies at the University of Alaska in Anchorage. The Institute was established in 1988 to focus on the health issues of people of the circumpolar north. My background starts 30, 40 years ago now, where I received a bachelor's degree in biology. And I worked on cold physiology, looking at how the body works in mammals in the Arctic. I spent a summer and a winter working at the Naval Arctic Research Lab in Barrow, Alaska. At that particular point in time, I became very interested in the process of how energy keeps animals warm in the far north. I was there doing research with the Office of Naval Research because it was a study of human physiology. And so what I learned was, rather than studying the wolves and the polar bears and the weasels, we should be talking to the people. I shifted my emphasis at that point and started focusing much more on health versus biology and physiology. And the health process got me talking to the native people of Barrow and asking them, how do you live so well in this cold environment? At that particular point in time, I then did some interviews in regards to the process of Arctic survival and documented those stories from the indigenous people of the Barrow region. That report was put together into a manual, a survival manual for high school students. So I've had a long-standing interest in life in the far north and how to live in a cold environment. One of the things I was told repeatedly was it depends on the food. And it really is quite important what you eat in order to how well you stay warm. First time I had seal oil, I couldn't get over how rapidly I felt warm after having the seal oil. And I learned that it's a very digestible fat that does allow your body to make lots of energy. Likewise, if you don't drink water, you can't make heat. And so a constant supply of water is very important to being able to metabolize. And as I looked at these various components, I started realizing this is important, and that how the diet and the traditional cultural patterns tie together to keep people healthy. For the past 10 years, I've been working at the Institute for Circumpolar Health Studies and have been very interested in environmental health issues, and again, looking at some of the issues in regards to contaminants from all over the globe, how they come to the Arctic, and what impacts they may have on food.
Hello, my name is Larry Merculieff. I'm an Aleut, born and raised on St. Paul Island. I'm the Deputy Director for the Alaska Native Science Commission, and I was the science advisor for the Commission conducting contaminant surveys throughout 5 regions of Alaska a couple of years back. And I had a traditional upbringing and about 20 years of grounding in Western science.
My name is Pamela Miller, and I'm a biologist and also Executive Director of Alaska Community Action on Toxics. And we're a statewide environmental health research and advocacy organization that focuses on protecting the health and well-being of all Alaskans. And in particular, we've been working with tribes around Alaska in order to reduce and eliminate the sources of toxic contamination that might affect both traditional foods and the health of all people that rely on traditional foods as a key part of their diets.
My name is Viola Wari. I'm St. Lawrence Island Yupik from Sivunga, Alaska, which is located in northwestern Alaska. I coordinate the Environmental Health and Justice for Norton Sound project, which is a community-based participatory research project. And my position as project coordinator is to ensure that the community members who we work closely with, the leadership, that their concerns and issues are addressed and communicated to state and federal agencies. Since we have military contamination on St. Lawrence Island, that's mostly who we work with. We coordinate with State University New York, Norton Sound Health Corporation, the healthcare provider for St. Lawrence Island, and the communities of Sivunga and Gamble on St. Lawrence Island. And our research has shown that we do get global transport of contaminants that come in through air and ocean currents. The Arctic is like a dumping ground for these toxic chemicals that come in from other countries in lower 48. And also, we were able to determine the higher levels of contaminants that we're seeing from the military contamination, the 2 formerly used defense sites at Northeast Cape and Gamble on St. Lawrence Island. And our community members are concerned about the health effects of these contaminants that we're seeing in our environment, in the blood of our people. And there's concern about the contaminants being in our traditional foods. And this project, we work closely with the community and leadership to give them data and research so that they can make their own informed decisions.
Hello, my name is Betsy Nobmann. I'm a nutritionist. I've been a public health nutritionist in Alaska for over 30 years. And during that time, I've had a chance to travel around the state and meet many people and talk about the nutrition and health issues that are concerning to people. Along the line, we found that there are things people are concerned about, and so found that research was important to conduct. And I've had the opportunity to be involved in 6 different dietary surveys. These help us to tell you a little bit better about what are the good choices and how to make the best choices of foods for your health.
Well, I'm Dr. Gary Fergusson, and I'm the wellness coordinator for Eastern Aleutian tribes. And being a naturopathic physician, a lot of what I do is primarily focused on diet and lifestyle. And so a lot of what I do in the Eastern Aleutian and also Pribilof Island region is to reinforce healthy eating habits and lifestyles that are conducive to wellness, and ideally prevent disease or optimize patients' wellness who have different diseases, such as diabetes, which is a primary focus of mine, and also identifying other contributors to disease, such as tobacco prevention and addressing also the issues around substance abuse, alcohol, and a lot of what I do is prevention-oriented, though.
Hi, I'm Sara Moses, and I'm a PhD student at the University of Alaska in Fairbanks. And my project is working out of Kotzebue, Alaska, and I deal with seals and fish up there. And what I'm studying are nutrients and contaminants in those species, and then in those species when they're turned into food for subsistence users. So I'm trying to let people know how nutritious their foods are and whether there might be any contaminants of concern in those foods.
My name is Donna Willoya. I'm research coordinator with the Alaska Sea Otter Steller Sea Lion Commission. My job basically covers marine mammal biology with sea otters and sea lions. With sea otters, there's a huge handicraft issue with this office. We support the handicraft issue. With sea lions, a lot of the hunters and a lot of the local people want to investigate or help contribute to investigating the health of the species, as well as finding out how much good sea lion is for you. What are the nutrient values of sea lions, as well as the contaminant values.
I'm Todd O'Hara, and I work for the University of Alaska Fairbanks. I'm a veterinary toxicologist, which means I'm trained as a veterinarian, and I study toxicants. And one of our focus areas is contaminants in the food supply of people in Alaska. And of course, that means we study wildlife and fish because that's where a lot of the food comes from in this state. So our laboratory is basically a chemistry lab and an animal health lab, and we have graduate students and postdocs and technicians, and we all work on various projects that involve animal health and contaminants. So what we're really interested in is not just the levels of the contaminants and the nutrients in the foods. We're interested in their effects on the animals and their effects on people. And so that's why we call it toxicology, because toxicology is the study of toxins, whereas analytical chemistry measures the chemicals in the tissues or in the foods that we're interested in. So we're really interested in what the effects are and the potential effects might be for these contaminants that we find in wildlife that people depend on for food, as well as we're interested in the animal health that go together. We can study the animals as food and for their own health at the same time. So that's what we like to do at the University of Alaska Fairbanks in our wildlife toxicology laboratory. And we've been there for about 2 years, and we're funded by the National Institutes of Health for about 5 years in one project, and hopefully starting this summer for 5 more years as a part of another project with the Center of Alaska Native Health Research. So we feel very good about the support we're getting, and we're also very happy about some of the local support we're getting from people to do these activities in the villages, which is very important. And some people have already talked about the community participatory research, where a lot of the questions and the concerns come from the community, and then we try to help them address those questions. So that's what we do in the Wildlife Toxicology Laboratory for the state of Alaska.
Hi, my name is Lori Verbrugge, and I'm a toxicologist with the Alaska Division of Public Health. Toxicologists study poisons and how they affect the body. It's very interesting. As an environmental toxicologist, though, I mostly look at chemical contaminants in the environment and how they affect human health. And one of the main things that I study is the effect of contaminants in traditional foods, whether they cause a problem or not, or whether they might be toxic, and looking at the overall picture of both the risks and the benefits of traditional foods to develop consumption advice.
I'm Bob Gerlach. I'm a veterinarian, the state veterinarian for Alaska. And in my job as veterinarian, I'm involved with a number of different things in the state. We work on the fish monitoring project that looks at contaminants in fish and food, but I also work as a veterinarian to evaluate ensure the safety of the wildlife resources and the domestic food resources in the state, specifically with animal diseases and disease surveillance. And I think it's very important in the fact that we see now, just recently, how we look at the one world and one health. We know that animal health is related to human health, and environmental health is related to both animal and human health. So we look at one large system of health effects and food safety.